Are you curious about Gestalt language processing? You are not alone. Join me, Corinne Smoose, and speech therapy PD for our podcast, The Gestalt Get Together. Our episodes try to balance the enthusiasm and excitement about GLP and its associated intervention ideas, as well as a healthy dose of skepticism about how to understand and integrate this paradigm shift into your career and the field at large. We hope that you can get together with us to learn more about Gestalts.
Welcome to Brainstorms, Functional Neuro Rehab for SLPs, presented by SpeechTherapyPD.com. This podcast is designed for the adult medical speech-language pathologist. Most of our audience members work in settings such as acute care hospitals, private practice, outpatient hospital clinics, and inpatient rehabilitation hospitals. Each episode has an accompanying audio course on SpeechTherapyPD.com and is available for 0.1 ASHA CEUs. The content of this course is based on the research and experience of the presenters. The listener is responsible for researching to determine if the information and skills taught are appropriate for their clients, students, or patients. SpeechTherapyPD.com does not necessarily endorse, recommend, or favor the information shared, nor any of the claims, opinions, statements, offers, or services made by the presenter.
Hello and welcome, everyone. My name is Renee Garrett, and I am your SpeechTherapyPD.com podcast host for Brainstorms, Functional Neuro Rehab for SLPs. Before we get started, we have a few items to alert you to. Each episode is 60 minutes and will be offered for 0.1 ASHA CEUs. Here are the financial and non-financial disclosures. Fe Murray is an associate clinical professor in the Communication Sciences and Disorders Department at Northern Arizona University, NAU. She receives compensation for this podcast presentation from SpeechTherapyPD.com. No relevant non-financial relationships exist. For Jackie's financial disclosure, she is an employee of Health Pro Heritage and Emory Health. Statements in this presentation do not represent the views of these companies. She receives compensation for her appearance on this podcast from SpeechTherapyPD.com. For non-financial, Jackie Rodriguez is the owner of the Instagram account at unlearnwithme.theslp. My financial disclosure is that I'm a paid employee of a private consulting firm in the Commonwealth of Virginia. And as the host of this podcast, I do receive compensation for this from SpeechTherapyPD.com. And my non-financial disclosure is that I serve as the secretary for the Communication Disorders Foundation of Virginia. Questions tonight can be written in the chat box or the Q&A and will be answered at the end of the presentation. Now, without further ado, we welcome both Jackie and Fe, and I will read through their bios. Dr. Fe Murray is an associate clinical professor in the Communication Sciences and Disorders Department of Northern Arizona University, where she teaches graduate courses and supervises clinical practicums. She facilitates the clinic bilingual evaluation team, supervises bilingual treatment sessions, and provides training for parents and school districts at the state and national level. Prior to joining the NAU faculty, Dr. Murray worked as a bilingual speech-language pathologist for over 25 years in various settings, most notably in early intervention and in public schools near the Navajo Nation, and in communities with high Latin representation. Her clinical and research interest emphasize culturally and linguistically appropriate practices, impact of cultural values on treatment, cultural reciprocity in the clinical setting, effective use of interpreters, and client-family empowerment. Jackie Rodriguez, MS CCC-SLP, graduated from Georgia State University with an MS in CSD. She is a sequential L1 English, L2 Spanish bilingual. She began her career working as a bilingual diagnostician for a large, culturally and linguistically diverse public school system. She also has pediatric private practice experience. Jackie then transitioned into medical speech pathology as a travel SLP. She is based in Atlanta, Georgia, where she has gained experience working in SNFs, ALFs, so skilled nursing facilities, assisted living facilities, independent living, and outpatient geriatric community centers. In addition to working with Spanish speakers, Jackie has extensive experience evaluating both children and adults from other language backgrounds. Jackie is passionate about bilingual assessment across the lifespan, dementia care, functional therapy, and health literacy. Jackie's background as a third-generation Afro-Puerto Rican American and African American has also fueled her interest within the field. Jackie is passionate about educating others about race and ethnicity, mentoring SLPs of color, and encouraging heritage speakers to use their language skills as SLPs. Whew. All right. So thank you both for joining us tonight, and we will dive in.
Thank you for having us.
Yeah, for sure. I'm very excited about this. Just to kind of give a little background, I met Faye several years ago at the Council for State Association Presidents Conference in Little Rock, Arkansas. So that was 2019, I think. It was before, everything changed. And then I met Jackie a couple of years later and had the opportunity to present with Jackie via webinar and then also having her on the podcast. So welcome back to you, Jackie. But I feel like you both know I took a lot of educational work in Spanish and still feel like I'm completely clueless. So I'm excited about this because when we had this initial conversation, it made me think about how if you both have episodes or times where you feel like you're experiencing imposter syndrome or you're not feeling like you're, I don't want to say up to par because that's not the verbiage I want to use, but feeling like you're maybe not in the right space or time for your language, I can only imagine how that is impactful for our patients when they're dealing with all of these multicultural, bilingual, multilingual in some cases, issues in their daily life. And then you throw on top of that a language disorder, whether it's, again, I like to do across the lifespan sometimes because I think it really switches it up and it allows us to pair up what children, teens, early adulthood, and then all the way across the lifespan to geriatricians, what they must experience when they're being evaluated by a non-Spanish speaker. So one of the things that I thought was really important was to kind of identify what translanguaging is and how it's used by bicultural Spanish speakers.
Great. You want to take it away, Jackie, or do you want me to take it?
Why don't you start?
Translanguaging is kind of like a newer word. And, one of the things we're going to discuss this is just because we're bilingual doesn't mean that, or multilingual doesn't mean that we're up on all of the, the nuances of the coined terms, et cetera. We just happen to speak multiple languages. And so translanguaging is one of those that I'm thinking, is that like code switching or is that something different? And translanguaging, the way that I've sort of have begun to understand it, it's all encompassing. So that code switching falls under translanguaging, but translanguaging is when someone who's multilingual is using their full linguistic repertoire, and that use is honored, and we use it in our practice. I'm a whole package. I'm bilingual, but I'm not a great bilingual in some places and a better bilingual some other places, and that's all part of me, and that's how I express myself to whatever community I'm with. So sometimes, like with Jackie, quizás podemos hablar en español. So we might be able to speak Spanish and just say things here and there because I feel more comfortable with that. But maybe in another setting, where to have monolingual speakers that I'm speaking to, I might have a word that I want to say and I might just throw it in Spanish, but I typically wouldn't do that. But my culture and my background are all on display all the time. I just choose when to sometimes express myself linguistically in the other language or even dialects that I speak, right? So I see it and then it affects also how I do treatment. When I'm, as a person who's translanguaging, I adapt to the different dialects of my patients or expressing myself in Spanish and maybe giving them myself a little bit about my background, which might be different from that. So there's some of that reciprocity that goes back and forth. Oh, eres colombiano, yo soy cubana, you're Colombian, I'm Cuban. And we might find a place through our languages to communicate. So I'm not going to hide who I am. As someone who practices translanguaging, this is me. And my linguistic background does affect my interactions with others for good, always.
Exacto, Faye. And I think that a common misconception that monolingual people have about bilingual and multilingual people is there's a great image that I've seen circulating around the internet, and I've seen it in presentations where we talk about bilingualism. And it's an image of a person, and it has like two other people to the side of them. And it says that bilingualism is not one whole Spanish speaker and one whole English speaker together in one person. It's a mix, like Faye demonstrated, that sometimes when you speak two languages, there's just certain thoughts or ideas that just sound better in Espanol. And then there's some things that we just don't necessarily have a term for in Spanish. So we use the English word. And that's normal when you speak more than one language to kind of bounce back and forth between those two languages. And even another point too, so sometimes when you're a bilingual person that has been raised here in the United States and educated here in the United States, and oftentimes our heritage speakers don't have a lot of formal education in their heritage language, that everything that they learn is from home in their community. Sometimes we'll go to assess a patient who is a monolingual speaker of our heritage language, and there can be a disconnect there sometimes too, where we don't always have all of the words or maybe concepts in our heritage language. So I think that that's another really important piece that's missing as well when we look at how we connect with our patients, that we have bilingual clinicians who often use translanguaging, but sometimes we're working with monolingual patients who may not have a lot of exposure to English and might not have this translanguaging skill in their repertoire. So knowing how to adjust our language, and also knowing when sometimes we might have to get the interpreter. If you're like me and you're a heritage language speaker, there's no shame in getting a second opinion from whether it's an interpreter, or even if you have another bilingual colleague who's more familiar with the dialect and the language that you speak. That can help to kind of fill in the gap between your translanguaging and that monolingual patient that maybe only speaks the heritage language.
Yeah, that's so true. Thank you for saying that so eloquently.
Yeah, that both of those, I'm blown away already. But one thing I want to make sure we do, because I'm not sure everyone will understand the differences between, is there a difference between someone who's bilingual and someone who is a heritage speaker? Because I don't think that most people will understand what those two things look like.
Bilingualism is on a spectrum, right? So many people, will go their entire lives and speak their language, and they might be exposed to another language sometime in their life. And, Jackie said that she was a sequential English learner, right? So that means that she learned Spanish first, and then somewhere along the way, I'm sorry, the other way around?
It's the opposite. I learned English first and then learned Spanish second.
I completely backwards. We lead like opposite lives. It's really interesting.
Yes.
I started in inpatient rehab and ended with pediatrics, and she started with pediatrics and ended in inpatient rehab. So we have like this opposite thing. So my native language is Spanish. And so I am a sequential Spanish English bilingual, meaning that I learned Spanish first, and then I learned English later on in life. I was exposed to English at age 10. And so I had a lot of education. I learned how to read and write and do all of that stuff in another country in Spanish. That's my story, right? And so then I learned to speak English. And so my education from middle school on has been in English. Okay. So all of us have our stories. And so there are different levels of bilingualism. So my Spanish, that I had didn't stop at 10, because I went to church and I had social functions, and I was surrounded by a great community of Central and South Americans and North Americans, Mexicans or North Americans, right? And so that really enriched and kept my Spanish going. However, there are children and even adults now who may have learned Spanish first. Let's just say that for its sake. And then they got to like 4 years old or 5 years old, and then English was introduced. And so their Spanish stayed, they didn't never developed an academic Spanish, right? And so maybe they know how to converse home things about foods. Maybe their Spanish hasn't been established or hasn't grown past that stage. And then there are people who maybe went to school, maybe they moved from a different country in second grade, and then there was language loss because the parents wanted to learn to speak English and they stopped speaking Spanish at home. And so there are so many stories. Every single person who's listening here is bilingual, will have their own origin story, right? And so there are different levels. So the heritage language is the language that you were first exposed to. And it's the language of your family, your home language. So my heritage language is Cuban Spanish. And so that's my go-to. Now, do I speak hablo como una cubana? Sometimes when I'm around family, I can start with that accent. But when you hear me just talking normal Spanish, my Cuban dialect is not what I use. I try to use more of a middle of the road dialect. And as far as talking about speechy type things, or, I've really had to educate myself because none of my education was in Spanish with regards to undergrad and graduate school. And so, when we talk about true bilinguals, they're equally fluent in Spanish and English. No, there are very few people that are equally, and those probably have certain type of jobs where they use that language. We have some strengths in some areas and not so much in others, and it depends on the content. So I see this as a spectrum. I'm really curious, though, Jackie, to find out about how you learned Spanish and how that all came to be, because I just assumed completely the opposite.
Yeah. So I'm actually glad that you asked this question about what's a heritage speaker versus what is a bilingual speaker. So I agree with everything that Faye mentioned about how bilingualism is truly on a spectrum. So I'm a third generation Puerto Rican American. So my bisabuelos, my great grandparents came from Puerto Rico here to the United States. And so my story is a little bit different. When my great grandparents came here in the early 1900s, they came shortly after Puerto Rico became part of the United States and when Puerto Ricans gained citizenship. And even though Puerto Ricans are considered citizens of the United States, when they move from the island to the mainland United States, it still is a very similar immigrant experience to that of Latinos that come from other countries. And so at that point in time, there was no Spanish. My family came to New York, as most, immigrants came, and there was no Spanish Harlem. There were not large quantities of Latinos in the parts of the United States that were not once Mexico. I'm not going to talk about the Southwest because it complicates my story. So my point here is that there just were not a lot of Latinos in New York. It was not like it is today. At that point in time, unfortunately, you really had to either learn English to survive, or you ended up going back because you couldn't get a job, you couldn't work, you couldn't survive. And so I'm very familiar with my abuelo's story. My abuela died when I was very young. And the story that my abuelo always told was that when he came, his parents divorced shortly after coming to New York, and he lived with his mother. And his mother said, "En esta casa, tú hablas en inglés." So in this house, you're going to speak English, and you are going to go to school. You're going to learn English, and you're going to come home and teach me so that I can speak English and so I can get a good job. And so she went and got a job as a secretary. My bisabuelo, my great grandfather, on the other hand, never learned English, and he worked as a barber. And like I said, at that point in time, there was no Spanish Harlem. The Latino community was very small, and he had a really hard time sustaining himself. And so he actually ended up moving back to Puerto Rico. And so my family that lives in Puerto Rico is my family from his second marriage. And so if you ask my abuelo, he always says, like, I learned Spanish in the streets, because that was, his family's survival mechanism, that there was a lot of prejudice and discrimination towards people who didn't speak English, just like there is today, but it was different because there wasn't the community aspect. Then my abuelo and my abuela spoke Spanish to my dad and his siblings, but they spoke English back. So all of my aunts and uncles are what we refer to as passive bilinguals or receptive bilinguals. So they all understand Spanish, but don't speak it. But my dad in school, he learned Spanish. So he's now fluent in Spanish. And my dad was an auditor, worked in Latin America and used his Spanish that way. And then now we come to me. So I was born in Georgia in a mostly white neighborhood, did not have a lot of access to Latinos, and I learned Spanish in school. Now, I like to use my own background history to kind of demonstrate the difference between heritage speakers and bilinguals. So I learned Spanish with mostly other white American students. Even though, I was still learning Spanish, I was familiar with Spanish words. So I knew things like all the things we eat at Christmas, pernil, arroz con gandules, plátanos, all that stuff. So I had words and was exposed to words. And then I listened to Spanish music, didn't know the words. Some of the reggaeton songs that I listened to as an adult, now that I could understand, I was like, I had no business listening to them as a child.
I used to be on a website and I used to translate like reggaeton music. That was for fun. And I'm telling you, I learned a lot of dirty words. But anyway.
Yes, yes. And so, because of my cultural connection, even though I'm not a native Spanish speaker, it is my heritage language because I have that connection to the culture. And then, even I feel like I have a better understanding of like understanding my patient's culture, understanding how hard it is to maintain the heritage language and teach your child. Because I see with my family and how Spanish got lost over the generations. Whereas my peers and even our SLP colleagues who are non-native Spanish speakers and non-heritage Spanish speakers have a much larger gap in terms of their knowledge because they're missing that cultural piece that I was provided with when I was growing up. So
I like it. I think that's perfect. And I see where you're coming from with that because the language is more than just the words. It carries a culture, it carries a feeling. It carries, I mean, just the music, just the atmosphere of being in your home and having that be part of it. And even though you might not have been speaking fluently, you're hearing about plátanos fritos and frijoles negros and and that's just the foods, but you're about the dances and just the smells and the sights. It's different. And so I thank you for that perspective. Yeah.
So I'm on the opposite end of both of those because I learned all this vocabulary and language and stuff, and I can get the gist of what I hear. I can get the gist of what I read, but to come up with a response, most of the time I'm like, got nothing.
I read some research about what motivates people to learn a second language. Because my dad, he's been here since we arrived. I was a child, right? And so he's in his 80s, and he never learned English fluently. And he's a very smart man. He's a writer. He loves the word in Spanish. He's an orator. He's a preacher. So language is really important to him, but he couldn't pick up the English. And my mother did pick up the English. And we talk about why are people motivated? And the research shows that when you have the socially, that's the biggest motivator. If you want to be able to talk to somebody, you're, a girlfriend or your, your neighbors, or even like for me, it was at school. They talk about the silent period, that period of time when a second language learner is just kind of listening. My silent period is probably 5 minutes. It's just a personality thing. I wanted to talk, and I wanted to have friends. And so that was a really high motivator for me to learn English. And other people have other motivations, like a job, like I have to learn it because I have to be able to help my family, right? But it's difficult. People think this learning a second language is easy, but it's not. It's really hard, and we expect it to happen very quickly. And it's something that grows over time. So, like the bilingual that I was, maybe when I lived in East Los Angeles and that area, I probably was maybe better at Spanish than I am now. It's not like I'm losing it. I just don't have the amount of practice necessarily, and it takes me a little bit to get going. And so we need to just understand everybody's story and where they come from. And you embrace that. You can't make anybody feel bad. Oh, you look this way and yet you don't speak Spanish. And there's a lot of shaming sometimes that happens in our communities. Our own communities. ¿Qué te pasa? What's going on? Where's your Spanish? And you sound like a gringa, or and some of that brings shame. And then on the other hand, you are a second language learner. So maybe like for me, I've worked for a long time to get rid of my accent. I haven't completely gotten there, but I don't care anymore because now I embrace that's part of who I am. But in our field, they wanted us to sound as mainstream as possible. And so I really worked on my accent to reduce it. And I'm sorry about that because I think I lost part of who I am because of that. But there's pressure. Oh, you're pronouncing this word in English wrong, or, and in Spanish, you're not pronouncing that right, or you use the wrong tense. So we get it from all sides with this, I'm not enough, my bilingualism is, I'm either not good enough in Spanish and not good enough in English. And it's a really interesting place to be. I've survived that and I really don't care anymore. It's like, this is who I am. This is, this is, the result of, how I was raised, and that's okay.
There's
I mentioned that
right or wrong way to be bilingual. Sorry.
There is no right way to be bilingual. I love that. I love that.
Well, and I mentioned that recently to someone about dialectal, because I think that's an important piece, and you kind of touched on that, different dialects within the same language. But like for me, when I went to apply to graduate school for speech, there was a point in which they wanted me to go for accent modification because of my coastal borders line Southern accent, and they didn't understand. It's really a Eastern North Carolina because that's where my family's from, and I'm with you, Faye. I don't care. I mean, it is what it is, and it's not going anywhere. I'm not 27 anymore, maybe 30. No, I'm just kidding. It's not going anywhere. And I think, when we're looking at the roles and responsibilities that we have, whether it's a dialectal speaker that we could even, and we don't have to because we won't have time, but African American dialect, and then just the roles that we have to look at for us as like me, again, not bilingual by any stretch, but thinking about what our patients' needs are. And I don't want to say requirements because I think that makes it sound negative, but their needs. What do they need in order for us to operate in different settings and meet them where they are as either monolingual or bilingual speakers? Because I think that's a really important topic too.
Yeah, I think to touch on both of your points, to touch on what Faye was mentioning about how when you're bilingual, there's so much discrimination and just like discomfort from within your own community and within the outside community as well. And I think that that really contributes to the imposter syndrome, where because bilingualism is so not well understood by the majority. And then you look at our field specifically with Latinos, with our field being majority white and not a lot of Latinos in the field, we don't have that representation to say, look, this is normal for people who have learned English second to have an accent and to make errors. Sometimes that's totally fine. And also for people who, learned their heritage language exclusively at home and never received, a lot of formal education, there's going to be some gaps where it comes to being able to deliver highly technical information about our field in Spanish. And then on the other side too, one of the other issues that we deal with that is a result of all these things that I just mentioned also is that even within the Spanish speaking communities, there's like you mentioned, African American English, and there's discrimination towards certain dialects of Spanish. I know Caribbean Spanish just is very similar to your Caribbean English, how like people from Jamaica talk, and it's Spaniards who colonized these islands came from the Canary Islands. And so the Castilian Spanish was different. And then it's also highly influenced by West African languages from the slaves that were brought over. And so there's a lot of just negativity towards Caribbean dialects as well. So even, it's important that, us Spanish speaking SLPs are thinking about our biases about different dialects in Spanish as well. And because we don't have enough representation with bilingual Spanish SLPs, we don't have enough of these conversations to talk about like, well, we know the bias that is directed towards us by people who are not Latino, but also within our own community. Like, here's our bias that we have as well. Or even, another thing that I'll see sometimes too is we know our field is most accessible to people who come from a higher socioeconomic background. And a lot of times our patients and students that we work with might be from immigrant backgrounds, might be from very low SCS backgrounds, and just checking your bias about like, what kind of assumptions do you make about people who come from a lower background? So there's a lot of gray area in the bilingual side of our field when it comes to bias and making sure that we're providing the best care for the people that we work with.
I agree. I mean, I think you said it beautifully. I think that we bring something though, even when we're not speaking Spanish. I'm just thinking just very recently, we have a patient with a TBI and, he's bilingual, right? But they've only assessed him in English. And, he's got this prosody, they're talking about prosody and how he has a lot of breaks in his language. And I'm like, well, have you tested him in Spanish? Because it could be that, he's a second language learner. And so it's that insight that even though we might not necessarily, have to use Spanish in our practice all the time, sometimes we understand, the questions to ask or the, just that perspective to take. Going back, Cuba and Puerto Rico, we're neighbors. We have a lot of the same foods and very different, political experiences, but definitely very familiar. And I see a lot of what you're talking about, but dialectal. If you watch the news in Spanish, you're going to get mostly white, fair broadcasters who speak this very middle of the road Spanish without any of these dialectal differences. Very similar to the newscasters from New York that for ABC, NBC, CBS, they're not speaking with a twang or with, or they're not using vocabulary that is dialectal, right? Or that's specific to a region, excuse me. And so you can maybe see that, somebody speaking with a Southern accent, there are all kinds of biases in some places with that. It's very similar in the Spanish speaking world. My dad, who's reads and writes and such, he would always have his Diccionario de Real Academia, which is like the dictionary from the Academy of whatever. This is the book that tells you of that, if the word parqueo really exists, and parqueo does not exist. The word is estacionamiento. It's like, okay, I mean, because we've taken this English word and we've merged it with a Spanish word and we call it parqueo. There's the parking is an example. And my dad would quickly look it up. Parqueo is not here, and it's that closeness. And you see the same thing. Prescriptivist in English, right? They're saying we don't use this kind of word, or we don't use the sentence structure. It's those people that don't see language as fluid. That we don't speak in English the way that they spoke in the Shakespearean times. In Spanish, we don't speak like, La Reina Isabela. It's, that has moved along, and dialects, need to be embraced for what they are, which is just an expression of your culture and of your background, and be embraced. But we need to be able to, to know that as Spanish speakers, and to celebrate that and the uniqueness and the wonderfulness of the dialects and what they express. And I want to talk a little bit about interpreters really quick. Just because you're bilingual doesn't make you an interpreter or a translator. And I think that's really important to understand. I worked as a professional interpreter and translator when I was younger. And I'm telling you, that's his own thing. So if you grab somebody like, who's just walking by and bring him in to translate or to interpret during a session, you don't know that they might not be literate in Spanish. They might be at a different level they might speak a different dialect. They might be at a different level of their bilingualism, and may not be able to tell the client that, we're going to be doing a modified barium swallow. I mean, that's a pretty hefty thing. You have to have, some background knowledge about medical terminology and medical things before you're able to interpret that kind of thing. So please understand that just because you speak a language and you might not know what level, and that doesn't make you a professional interpreter or an interpreter at all. So that's just something I kind of wanted to throw that in, because I think you mentioned something about interpreters. Not all of us are great at it, right? And it depends on the context. I used to interpret for legal, for the courts, and that was a very specific vocabulary. And I was also a medical interpreter for a while, but I've lost some of that. But if you put me in an IEP meeting, I probably can do really well at a school setting, because I know that vocabulary. Take me out of that and have me, interpret maybe even for a medical SLP now, where I just don't have, the skills of the vocabulary anymore. You might be really disappointed and think, she doesn't speak Spanish. It's like, I do just that kind, And so, yeah, sometimes it's important, even if you have, another thing is that, like Rodriguez, right? My maiden name is Gonzalez, and I use Gonzalez Murray as well. But sometimes we see somebody with a last name or a first name that's like, Spanish sounding, and we just like assume all kinds of, proficiency in that language, and we can't just make assumptions, just like many people have German last names or, whatever, and they don't speak German anymore because their family has been here a long time or they were never exposed to it. So I guess the lesson here is don't make assumptions. about
Well,
anything.
and I think it's a really good point because I know I worked with a coda when I was in IPR who was second generation, I believe, but family was from Dominican Republic. And so she learned Spanish in the home, learned English kind of at the same time, but her formal education as like a kindergarten, elementary school was Spanish. And then they came here full time because I think they split time between the two countries. And so anyway, she had mostly her formal education in English, but she went to be a translator for our health system and she had to go through some training and classes and pass a test, and she couldn't pass the test because exactly what you said, she didn't have the specific type of vocabulary they were looking for as a medical translator, despite the fact that I've heard her speak Spanish and I don't know, I mean, it sounded great to me, but I don't know. You know what I mean? Like I'm not the expert. I'm not the person who's going to need that translation service. And I think the flip side of that was what if what if somebody was maybe working, because I have friends who go down and do medical missions in Caribbean countries and in Central America and South America, and they maybe aren't fluent. Maybe they have a little bit of Spanish, but they're not fluent. But what if they had a medical emergency and they need someone to translate in English? So we had, again, I think thinking about that both ways makes a lot of sense because we assume that the translator is the savior almost. They're
Well,
going to be the one.
it's really
Yes.
funny is, when you're trained, I don't know if this happened to you, Jackie, maybe when you've used other interpreters, but, sometimes when you get like, you bring the cart, right? So you got the interpreter on, on a screen. And
Mhm.
and sometimes depending on their state and how they interpret regulations, I'm a member of and I should have said that I'm a member of the American Association of Interpreters and Translators in Education. I think I'm the only SLP that's a member of that, and it's pretty new. But so I get a lot of information from them. But let's say that you're doing an oral mech exam, right? You're doing a motor exam or something like that, and you're looking at the patient and you're saying, open your mouth. And the interpreter says, abra tu boca, right? And so the patient who might have like some cognitive impairments will look at you and then they'll look at the screen. And then, because they're supposed to say exactly what you say. So then you say, move your tongue from side to side. He said, mírame a mí, mírame a mí y move your tongue. Look at me, move your tongue side to side. So then the interpreter says, look at me in Spanish and move your tongue side to side. So then they're looking at the interpreter. It can get very confusing because some of them, will interpret exactly what you're saying, first person, which is gold standard for interpreters. But when you have a person with maybe that has some challenges, right? Because they've had, an infarct or whatever, then you need to be able to adjust. And some interpreters can do that and some cannot. And so there are tricky things that go on when we use interpreters. And many of them they're not SLPs. So, like we should never use things like, oh, he's, with school-based, he's fronting fricatives, because it's like, oh, está, whatever, fricativos and whatever they're going to say. They don't know what they're talking about. And sometimes they don't have the vocabulary. And so we have to really understand that when we're using an interpreter, that person who may most likely is not somebody in our field probably needs the wording to come out in a way that the patient's going to understand. It's your mother sitting in front of you, somebody who doesn't know anything about our field. So we have to be really conscious of that and always looking at the patient and treating them with respect. I tell students that, Google Translate has really come a long ways, and it has, but it doesn't translate for like for the when you're dealing with an adult patient, you don't want to tutear, like you want to use usted, which is like the more formal way of addressing. And many times these translators will default to a less informal language, and it can lead to some uncomfortableness, right? And then sometimes if you put too much into it, it's very I guess it's very sensitive to punctuation. So you got to be really careful, and it won't do like the idioms and things like that. So you have to keep your language very simple. You type it in and it can help in a crunch, but there's really no, the live interpreter is really the way to go when you can. And if you're in a crunch, you can use maybe the app, but I wouldn't rely on that because we're just not at Star Trek right now. We're not at the place where we have these international, I wish, I'm a big sci-fi fan. We're just not there yet. And we just need to be conscious of what we're saying and make sure that we don't rely on the interpreter to fix what we're saying, they're going to say exactly what we're going to say. So we have to be really careful about the words that we choose and make sure that we have someone who is truly a professional interpreter and not just someone who's walking by who may or may not be, fluent. I had to put
And
that.
that's
I had to put
why
something
I like to take some time. Usually what I do is I will call the interpreter. I usually use my phone and call the interpreter because half the time my patients struggle to hear and I can't hear the iPad. And so I just put it on my phone and hold it right up to their ear so they can hear. And I usually like to call the interpreter outside of the patient's room and kind of prep them and tell them, I'm about to assess a patient who has dementia. If they don't understand, please don't repeat. Wait until you hear me repeat it. Or if they're not understanding you, tell me. Don't just keep, cueing them. Because I'll notice sometimes, like for example, I was working with a woman who was a Haitian Creole speaker, and the interpreter, like, they kept going back and forth, and I kept having to say to the interpreter, "What are you telling her? What are you telling her?" Like to make sure that I understood. So I think just preparing them, because like they said, interpreters are not speech language pathologists. So you have to make sure that you prepare them for what you're going to do. And then another thing that I often see is I will have people who will say, well, sometimes I'll have a patient who, like, I feel like they need an interpreter, but then I go in the room and they're like declining. They don't want to use an interpreter. And so that's another reason why I just have the interpreter on the phone and walk into the room with the interpreter. And then they could still, patients have the right to refuse. So if they, want to say like, no, it's okay. But what I've often realized is that a lot of times people feel like they're inconveniencing the healthcare worker to go get the interpreter. And so I'll just have the interpreter on the phone. Like an example today. So today I had family education done for a patient who is bilingual in Vietnamese and English. He actually speaks English better, but his wife, when I was going to get him, the nurse was telling him that telling her that she was giving him a medication for spasms. And she was like, spasms? Like, I don't know what that is. And so I told her, I was like, well, would you like me to get the interpreter for your comfort in case there's something that I say that you don't understand, just so you can have it? And at first she was like, no, it's okay. I could look it up on Google Translate. And I was like, it's fine. I was like, I'll have the interpreter. And so we called the interpreter and I said, interpreter, I'm just letting you know, I'm doing some family education. I have a woman who's with me who's bilingual in Vietnamese and English, but every once in a while she doesn't understand and I might need you to jump in and interpret. So I'll let you know. And so that was probably his easiest session of the day because he literally just sat there on the phone for 30 minutes. And she ended up saying, well, I can understand you much better than the physical and the occupational therapist, which that often happens because we know how to break things down in a way that's easier for people to understand. But because I automatically gave her that option, I didn't put her in a position to make her feel like, oh, like I'm causing an inconvenience. And then she had that resource accessible to her so that she could make sure that she fully understood what care her husband needs.
I think that's part of cultural humility. To put yourself there in the other person's place and just try to understand the situation. And people say, well, if you speak this language, why aren't you just, if you speak English, like when I go to the stores and I hear people speaking Spanish and, they might speak English, I just jump in there and speak Spanish, so it's part of who you are. And knowing that somebody else may not be able to understand is something that we have experienced and that, especially like me, and can, it's really nice to have somebody watch your back, right? And that's exactly what you did. My mom sounds pretty fluent, but when they're talking about medical terms and medication and all that, sometimes they might not be able to understand exactly. There's something because of vocabulary and it's just nice to have that interpreter. So she always, even though she speaks and writes and reads fluently in English, she always has an interpreter for a backup, and I think that it has been helpful. So I'm so glad that you had that experience today because that's beautiful. That's exactly what we need to consider. Don't just take their word, for it because they're trying. Again, we don't want to, no queremos, molestar, we don't want to be a bother to you. And they're not used to the fact that this is part of your care and it's okay. So.
Right. So earlier, Renee had mentioned that, like, gave the example of like an English speaker who maybe is conversational in Spanish and is, on vacation in a Spanish speaking country and ends up having an emergency situation. Like, even me, like, I am bilingual and treat in Spanish. And if I were to have a medical event for my own comfort, if I were in a Spanish speaking country, like, I would still want an English interpreter, because sometimes it just, with the anxiety and when you're in a medical situation, like, you're in fight or flight mode, like, it's harder for you to process information in your second language. And then if you add on to that a communication disorder, it just makes it easier, even if the person is bilingual. And then another point, I know we're kind of like jumping all over the place here too.
That's fine. I love it.
One other thing that I see frequently that happens with our monolingual SLPs, or even bilingual SLPs who are not heritage speakers. One thing that I will see is they will come into the patient's room, to a bilingual patient's room, and say, do you feel comfortable if I do this assessment in English? And then they'll document the patient declined an interpreter. And especially when you are doing an assessment, you don't
Illegal.
I mean, I know earlier that I said that the patients have a right to refuse, but if it's a stroke or a TB, I'll be like, mira, yo voy a hacer mi evaluación en ambos idiomas, because I need to be able to see what you can do in each language. And like, I will kind of, if they're like declining, or if they're declining an interpreter, I'm gonna give more education. Well, here's what can happen with a bilingual brain. You might have one language where your language skills are intact, and you could have another language and your language skills are completely wiped out.
We've seen that. Yep.
Yes. Yeah. And so we'll, if you, si tú prefieres hablarme en inglés, está bien, pero for this assessment, like, I've got to do it in both languages. And then we could do our treatment in English if that's what your preference is. So
it just made me think, as you were talking, that sometimes we have people who are not heritage speakers who learn English as Spanish as a second language, or another language, which I think is amazing, by the way. I mean, I had to learn English, but somebody that goes out and just learns another language like you, Renee, I mean, I have all, all kinds of kudos for you, but use what you know. I mean, if I'm, in a trauma situation, you think about that heritage language, you think about what that means to you and the comfort that it brings to you. We talk about love language. My love language is Spanish. It's the first language where I heard, caricias and, cariños and, that love language. The first time I heard somebody tell me I love you, or maybe not, because in our language, you don't say it as freely as you do in English like that. But I mean, when all the comforting words and things like that, they were in Spanish for me. If I'm sick, and I can just think of when I'm not feeling well, my mom, how she used to calm me down. And that's that, basic, that's your heart language, right? And so, and I always talk about, like, in the pediatrics, talk to the children in the language that they use at home, because that'll be their comfort language. And it could be the same thing for adults. We were going to talk about, and I don't know if we have enough time, but about the preparation, right, of SLPs in the master's programs, or in master's programs, bilingual SLPs. And I don't know how it was for you, Jackie, but I'm old, so I went to school in the 80s, the late 80s, right? And so for me, no one cared I was bilingual. Like, it was not addressed, it was not brought up. It just didn't happen. So everything I've learned, I've had to learn since that time. I had absolutely no instruction in anything that had to do with culture or back. All I knew was me and my family and, my surroundings, and didn't make that connection with speech therapy at all. And so I just want to say that now there are a lot more programs that are offering, bilingual credentials, and even more that are offering more like, I don't like the cultural competence thing, because just the whole term, it's you're on a path to competence, right? But they're offering courses in multiculturalism and just helping you to learn how to evaluate and treat patients who speak other languages. Because frankly, and Jackie, I don't know if you speak other languages, but I only speak two. That means if I get a Vietnamese patient like you had, or somebody from Russia, I might as well be a monolingual SLP. Only I have the knowledge of bilingualism and the knowledge of how culture and language interact, et cetera. But they're just probably not enough programs out there that are providing this kind of, of instruction. And part of it is because when you get into higher ed, there just aren't very many, bilingual, people of color, multicultural individuals. They just aren't. Back in the day, in order to get a PhD, you had to show competence in another language. And slowly but surely, the other language became statistics. But anyway, that's a different issue altogether. But what can we do to prepare? What would you have liked to have had, Jackie, as you were going through school to help you prepare to be a bilingual, multicultural SLP?
Oh my gosh. So my experience was kind of similar to yours. I will say that my program director, so what I did was like, everybody in my program knew that I was interested in working with bilingual patients, and I definitely like advocated for myself. And so my program director did a good job of like placing me in areas that had large Spanish speaking populations, but I still, like you, I every time we had a research assignment, like I chose to write about about bilingualism. And I never had a supervisor that spoke Spanish. So I was really like on my own. And then this podcast episode is called, we talk about imposter syndrome, but it created a ton of imposter syndrome for me because I felt like, should I even be doing this? Do I really have the language skills? And then, to be honest, like at that point in time, ASHA has done a better job of restructuring the standards for bilingualism, but it was all the standards were like native or near native proficiency. And it kind of goes back to what we said earlier about how that's just not the reality for many of us. That for many of us, native proficiency is translanguaging. It's not, we don't have the skills like the professional language in both languages. And so I think, even if you're a professor who doesn't speak another language and you have a student who speaks a different language than you, and that that's what their interest is, like encouraging them to do what I do. So like if you're assigning some sort of research paper, assign them a topic about the population that they want to learn. Give them assignments where they have to, memorize, phonetic features of Spanish influenced English or phonetic features of different dialects or whatever dialect of Spanish they speak. Have them do a report on that. Yep. Just ways to like incorporate their interests. Like obviously the gold standard, the most ideal option would be to start a bilingual program, but we know that we just don't have enough bilingual SLPs who are professors to even do that right now. So, but there are ways that you can encourage and help to grow those skills, connecting them with other bilingual speakers, which I'm going to go ahead and put a plug in here. I'm a lead mentor for the Bilingual Empowerment through Allied Mentorship Program. I don't know if you're a member, Faye, but we'll be talking about this afterwards because we need you in this program. So we've turned it into a 501c. We're an online mentoring program. We are all bilingual SLPs who are looking to bridge the gap because just like what you mentioned, many of us don't have that formal training in grad school. And we mentor undergrad students, graduate students, and CFs. And so
love it.
So just that has really like improved my confidence and being able to like talk with other native Spanish speakers and hearing that like they're having the same issues that I have. Because so many times I would attribute it to like, oh, well, I'm not a native Spanish speaker. Or even like how you said earlier, how within our own communities, how there's so much like stigma towards non-native speakers, right? And just feeling like, okay, I'm not enough. Like I don't really deserve to be here. Like I don't deserve to say that I'm really a bilingual SLP. But then when I got around this community of other bilingual SLPs, I was like, oh no, like this is a common experience what I'm going through.
We need to normalize it for sure. Yep.
Yes. So even helping your students to have a community, to have one other bilingual SLP that they can go to when they have these situations and they're not really sure, is it me or is it the system? So those would be my suggestions.
I think that programs can all have a bilingual evaluation team. I mean, when it's Spanish, obviously it's like I'm in my element, right? But if it's another language, we recently had somebody who was, who spoke, who's from Thailand, and they had English and they also had Spanish influence. We often evaluate people from different Native American, indigenous reservation and such. And so we all need to, none of us own that, just because I speak Spanish doesn't mean that, I can address and evaluate every Spanish speaker in the region. That's just like a really big burden. When you got your last name or you speak Spanish and everybody just looks at you and they just dump on you because you are bilingual and you're supposed to know everything. And like you just said, until very recently, there wasn't even, a lot of programs don't even have classes on this. So we're just like you. And so if every program had one and they can use evidence-based practices, they can use interpreters, there's lots of things that can be done. But I do like the idea. I think it's perfect. My doctorate is in cultural and linguistically diverse exceptionalities. And so all of my assignments were, even though it's an EDD, speech-based bilingual stuff. That's where I got a lot of my education from, was pretty much just focusing all of the papers and the readings that I did in my dissertation, et cetera, on, bilingualism. That's how I learned it, because I certainly didn't learn it, academically from my program. So each program has a responsibility and not just putting it off. Oh, here comes Faye. She's going to give us the once a semester lecture on multicultural evaluations. I don't have the corner on that. I've had to study it because I have to do it. But everyone should, kind of level up, and knowing that with, over 90% of, SLPs out there who are monolingual, it's higher than that, but it's really, we're never going to get to 50% or to, whatever. We're just not. There's so many different languages, so many different dialects, that it is unreal to think that we're going to have a bilingual SLP to cover everything. We're not. So that means that the rest of us have to level up and learn how to do these kinds of evaluations. And the university programs have to really address it, because we live in a multicultural world. And so they have to take that step and have, outcomes. We want students to feel comfortable using interpreters. We want students to understand the intricacies of second language learning, bilingualism, trilingualism, et cetera. And it can't just be one lecture once a semester. It has to be embedded in all of the coursework that we present. That when we're talking about feeding and swallowing, for example, that we also talk about the cultural background about, regarding that, and you can investigate that. You can invite speakers and such. And of course, we can't know everything about but we have to make that step and do the best that we can with what we know, rather than sit back and let some other, bilingual, culturally diverse person, who may or may not be there, take it off your hands. It's not realistic. There aren't enough of us, and we're pretty busy as it is, and trying to figure out what we can do in our professions. Yeah,
absolutely. It's everybody's responsibility to treat bilingual people, not just the bilingual SLPs.
Okay. This was a fun conversation.
You guys are great. You had your own podcast episode just now, which is great.
Renee, where were you? I
was nodding.
This just shows you that we need to talk about these things. Jackie Hoff, and now that you have this group that you're going to tell me all about, we just need to have these conversations to just acknowledge that that what we're feeling is real, and it's okay, and that, we just have so much to say and nobody to say it to. So this was really important for me, very therapeutic, and thank you for providing this space.
Yeah, it was very important to me, because I think it was eye-opening as a mostly monolingual English speaker, because again, some of the points you made about using translators, to me, I don't know what the validity is for the translator to come in and translate something medically complex when I'm working, when I was working in acute care. You mentioned modified bariums. I've had to use interpreters a lot of times in modified bariums, and I have no idea what they're talking about. And then sometimes the patient would get the barium in their mouth, and they're telling them to swallow, swallow, swallow. Well, I didn't tell you to tell them that. We want to see the naturalistic setting. So I think that kind of plays in there on all aspects, because you mentioned language, you mentioned dysphagia, and both of those things, depending on your setting, are things that we work in all the time. But just in general, wow, this was just great. I don't see any questions in the chat box. I did see early on there was someone who commented Maria. Idioms are a prime example. They just don't translate well. And I think, again, you touched on that a little bit and how that's not going to be something you can necessarily get a good translation of in Google Translate. But, any kind of final thoughts? I appreciate you both so much and always learning from both of you.
I have a Facebook group that I administrate. It's called Bilingual and Multilingual Speech Language Pathology. And just recently I put on there, okay, 5 free, consults for half an hour. And, people are like so hungry for this information. I mean, these are bilingual SLPs or maybe monolingual, and they really want to figure out, how to make it work. And I've met some interesting people from, all over the country just in this month who just kind of want, and a lot of them know what they just want like affirmation and support that what they're doing is correct. And some just like, I have no idea what I'm doing. And so then we guide them through a protocol and such. But there's such hunger, and not only the hunger, but there's a true need for this kind of for understanding bilingualism. And there's no time for us to have the imposter syndrome. We just are who we are. And we are not going to be apologetic for not knowing all the Spanish words or not knowing all the English words or just not speaking the same dialect. We have no control over that. We are who we are, and just our love for the work that we do and our genuine care for our patients should just drive us, and that should be enough, right?
Absolutely.
Yeah. I just want to add, if you're a bilingual SLP who's interested in being a mentor, we always take volunteers. We're always looking for more mentors. And you can find us on Instagram. Our Instagram is the BEAM, BEAM SLP program. We would love to have you.
I'm going there now.
Well, again, gracias, Jackie, Faye. This was great. I'm so grateful to both of you for sharing in my vision and entertaining me, because I wanted to do the questions in Spanish, but I'm not that proficient. So I think this was a great episode, though. And so I appreciate you both being here tonight. Thank you. And we look forward to seeing you again.
If you have indicated that you are part of the ASHA registry and entered both your ASHA number and a complete address in your account profile prior to the course completion, we will submit earned CEUs to ASHA. Please allow 1 to 2 months from the completion date for your CEUs to be reflected on your ASHA transcript. Thank you for joining us at today's podcast. Remember to go to speechtherapypd.com to learn more about earning ASHA CEUs. We appreciate your positive reviews and support and would love for you to write a quick review and subscribe.